So today we're going to be talking about valley fever. This presentation is by Hilary Camacho, Ashley Deep, Hayden Thomas, and Michaela Zavala. We'll go over what valley fever is, transmission, symptoms, complications, diagnostic testing, treatment, prevention, prevalence in San Joaquin County, and education.
What is valley fever? Valley fever is an airborne fungal infection. It starts in the lungs, and if not treated, it spreads to the bones and destroys them. It is also referred to as San Joaquin Valley fever. Its name refers to the San Joaquin Valley in California, where the disease was first linked to the fungus. Transmission. Valley fever is caused by the fungus coccidiosis. This fungus is known to live in the soil in the southern western United States, parts of Mexico, and Central and South America. Highly endemic areas include Southern California and Arizona. Valley fever is typically acquired by inhalation of the fungal spores. In the soil, the fungus grows as a mold with long filaments that break off into airborne spores when the soil is disturbed. The spores are extremely small and can be carried far by the wind. A person can then inhale the spores. Once inside the lungs, the spores reproduce, continuing the disease cycle. In extremely rare cases, people can get the infection from other sources, such as from an organ transplant if the organ donor had valley fever, from inhaling spores from a wound infected with coccidiosis, from contact with objects such as rocks or shoes that have been contaminated with coccidiosis. Symptoms. Many people who contract valley fever are asymptomatic. Only 40% of the cases present symptoms. When symptoms do occur, they resemble those of the flu. Symptoms of valley fever include fatigue, cough, fever, shortness of breath, headache, night sweats, muscle aches or joint pain, and a rash. Symptoms of valley fever appear between 1 to 3 weeks after exposure and usually last for a few weeks to a few months. However, some patients have symptoms that last longer than this, especially if the infection becomes severe. Complications. Some people, especially pregnant women, people with a weakened immune systems, or those of Filipino or African heritage are at a higher risk for developing a more severe form of valley fever. Complications of valley fever may include severe pneumonia, ruptured lung nodules, or disseminated disease. Most people recover from valley fever-related pneumonia without complications. Others, mainly people of Filipino and African heritage, and those with weakened immune systems may become severely ill. A small percentage of people develop thin-walled nodules in their lungs. Many of these eventually disappear without causing any trouble, but some may rupture, causing chest pain and difficulty breathing. A ruptured nodule may require the placement of a tube into the space around the lungs to remove the air or surgery to repair the damage. Disseminated disease is the most serious complication of valley fever, but it's also very uncommon. If the fungus spreads throughout the body, it can cause problems, including skin ulcers, abscesses, bone lesions, severe joint pain, heart inflammation, urinary tract problems, and meningitis.
Diagnostic testing. The most common way valley fever is diagnosed is by a blood test. A blood sample is taken and sent to a laboratory where it is evaluated for coccidiosis, antibodies, or antigens. Results from a blood test may take anywhere from a few days to a couple of weeks to come back, depending on where the sample is sent. Imaging tests such as CT scans of the lungs or chest x-rays may be done to look for valley fever pneumonia. If you have a history of valley fever, a skin test may be conducted. The test is similar to a TB test where a small injection is made under the skin. If the test is positive, a bump will appear. The injection site must be examined in 2 days by a healthcare provider. A positive test indicates your immune response to valley fever because of a current or past infection. And a negative test means no exposure and you have not have had valley fever. False negatives may occur, and any healthcare provider can order a test for valley fever.
Treatment. For many people, the symptoms of valley fever will go away within a few months without any treatment. Healthcare providers choose to prescribe antifungal medications for some people to try to reduce the severity of symptoms or prevent the infection from getting worse. Antifungal medication is typically given to people who are at higher risk for developing severe valley fever. The treatment is usually 3 to 6 months of fluconazole or another type of antifungal medication, such as itraconazole. There are no over-the-counter medications to treat valley fever. If you have valley fever, you should talk to your healthcare provider about whether you need treatment. The healthcare provider who diagnoses you with valley fever may suggest that you see other healthcare providers who specialize in treating valley fever. People who have severe lung infections or infections that have spread to other parts of the body always need antifungal treatment and may need to stay in the hospital. For these types of infections, the course of treatment is usually longer than 6 months. Valley fever that develops into meningitis is fatal if it is not treated, so lifelong antifungal treatment is necessary for those cases.
Prevention. It can be difficult to avoid breathing in the fungus spores in an environmental area where it is common. What you can do to try to avoid breathing in the spores are try to avoid areas with a lot of dust, like a construction site. Stay inside during any dust storms and keep the windows closed. Avoid activities that involve close contact with dust or dirt, like yard work or gardening. Use an air filtration system for indoors. And make sure to clean skin injuries well and thoroughly, especially if exposed to dust or dirt.
Prevalence of valley fever covers pretty much the entire southwest of the United States. In California, fever incidence increased from 213% from 2014 to 2018. As we mentioned before, the people most prone to getting valley fever include smokers, people with diabetes, pregnant women, and people with weakened immune systems. Also mentioned before, there are several steps you can do to protect yourself from contracting valley fever. For the general population, where air quality is rated as red for people with asthma or other respiratory issues, wear disposable N95 or P100 respirators. We're all pretty much used to that now with COVID, so this is good practice when conditions are not great for valley fever. While driving, keep your windows shut and use the recirculating air conditioning if available. That's just general good advice for freeway use as well. And then for construction and farmer workers, people who are in the dirt more actively, be sure to clean your tools, equipment, and your vehicles safely before transferring offsite. This will protect not only yourself, but your loved ones as well, who may come in contact with those items. There's more information about valley fever available at cdc.gov, and there's a link below on the right in this slide. Here are some resources available, or the resources we use for this slide.